Morning.
All right, how's it going?
Good. How are you? It's Delia and the intake team. We have 7 people in here.
Okay. All right, are you ready to get started, or do we need to wait a little bit?
Nope, we're ready.
All right, so I'll show you how to put a brand new patient into Care Efficient. My name is Brennan Cole. I'm an RN, work for Care Efficient as a senior implementation manager. Been working in Care Efficient for a long time, so I'll help you guys out going through this whole intake process. So the first thing is, obviously, you'll get an intake, whether it's via the phone or fax or email, etc. Once you get that information, you'll go to this patient menu up at the top. There's actually a couple places you can do it. There's this add referral down here on the left-hand side, and then up here under the patient menu, there's the add referral there as well.
Brendan, are you able to open up your screen a little bit more? If you go to the top right.
Sure.
It's him. Oh, yeah.
There we go. Okay, so let me sign in real quick. All right, so the first thing you're going to do is you're going to have to choose what agency this patient is going to go into. To start with, I'm going to just put one in as a home health training. When you flip to that agency, it is going to default the agency type to the home health, so make sure they should be set up to where everyone is set up as either home health, hospice, or for the caregivers. But it's going to be the same process other than you choose which agency, and the agency type should be defaulted there for you. If you click the drop-down arrow for the referral source, all of the most recent referral sources are going to be in there. Just choose one of them. If it's not in there, you can hit Find Referral Source right next to it. And you can search for the first, last name of that referral source or the facility name, but not both. Just use one or the other. And then hit search, or you can even leave it blank and it'll pull up every option you have available. So choose your referral source. If it's not in the system and you guys have permissions, you can add the referral source. But be careful if it is a physician, because you need to make sure it's not a duplicate or just, the name. Sometimes physicians use nicknames versus legal names, things like that. And you can never duplicate an MPI twice in here. So if it's a physician, be very careful about that and double check if you do have permissions to enter that. But once you put a checkbox next to that referral source, you'll hit Save. And then it's going to give you a little bit of a referral history. It'll tell you how many admits and non-admits you've had from this referral source within the last 30, 60, 90 days. So just a quick snapshot of how well they're treating you guys. The method of delivery is not required. The only things that are going to be required are these orange asterisks. So that's the bare minimum that needs to be entered to move forward. But this other information is very helpful too. You can track the method of delivery. You can track the referral source contact. So if it did come from a hospital and there's a case manager involved in that care, you guys could enter that information here. That way the field staff or anybody else could identify that if they needed to contact the referral source or where they came from. Under this next section, the initial referral information, you do need to pick the payer category. I'm going to choose Medicare for now. The referral date, the date you received the order. The requested started care date. If you have one, you can go ahead and enter that information, and it will flow throughout the system. And it can be changed if needed. If you know the admission source and the admission type, of course, for Medicare, you do need to answer those questions. If you don't know that information, when the clinician activates the patient, they have the opportunity to add that information as well, or it can be actually updated under the patient profile tab. So if you know it, go ahead and answer it, and it will carry forward. And then here's where you have the opportunity to select the disciplines that are going to be involved in the care. If you know already that they're going to need skilled nurse, PT, OT, et cetera, you can go ahead and click all that. A lot of times doctors will just say admit to home health, and you have to go assess the patient and determine their, what disciplines are going to need to be involved. So if you know it, go ahead and pick it. You have to pick at least one. This is going to carry over to when you schedule the initial visit. Whatever you choose here is what's going to be available. You do have an opportunity to add other disciplines after the patient's been activated. Otherwise, you do need to get them in here, and you have one other opportunity while doing the intake to get these answered. So I'm just going to do I'll do skilled nurse and PT for now. And then at this point, you could decline the referral if you find out they're not in, they're not in your service area, or that you don't meet the payer requirements, anything like that. You can just go ahead and decline and move on. But otherwise, just leave it defaulted to continue referral. Hit save and continue. And it's going to take you into the next, the setup patient screen. If you know the face-to-face doctor, you can enter that information here. This does flow to the referral tab as well. And then you're going to search for the patient. And if you know the birthday, medical record number, or patient ID number, you can enter that information. What it's going to do is it's going to search the system to see if this patient exists has been on service before. So you'll enter that as much information as you know. You'll hit search. And then down below here, you have the option to readmit an existing patient. So if it is a readmit, they've been on service before, you could put a checkbox next to their name and hit continue, and it'll take you to the next screen for the contact info. If it is not a new admit and they are not in this list, you can see everything that matches the information when I search for the patient. It is highlighted in yellow here. If everything was a complete match, obviously that'd probably be the readmitted patient. But obviously the first name's different. So we're going to scroll down here to the below that list, and it's where it says or add new patient. And we'll go ahead and start filling out the rest of this information, again, if you know it. If not, just the first and last name is all that's needed to move forward. You can add this information later after you get it. I'm going to go ahead and put my gender. And if they have an email address, you can enter that information as well. And then you'll hit continue, and it's going to take you to the contact tab, contact info. The left side is the patient contact info. So this is going to be their home address and any phone numbers that you need to list for the patient. This right side is add patient contacts. This is going to be next of kin, power of attorneys, relatives, whatever. You guys can list those if you have that information, and if they want to be listed in here as a contact, then you have the ability to add them at this point. And again, you can add them anytime throughout the care of this patient also. You do need to have a address before you can ever activate the patient. So go ahead and click on, sorry, I went too fast, click on the add contact info. Under the address type, you do need to choose whether it's home, mailing, or work. And then just go ahead and enter their information. Now for the phone numbers, even if they only have one number, put a check mark next to that number as being the preferred number. That way this number shows up on their disaster plan report, their patient encounter. It'll show up as a preferred number. Otherwise, it could be blank or would be blank. But you would still be able to find the number, but it wouldn't show up in certain places where it needs to. So always hit this preferred, even if it's only one phone number. But you can add other numbers. You can add as many as you need to. And just keep adding them. Just hit add phone, and it just keeps throwing new phone numbers over here. And again, put a checkbox next to at least one of them and hit save. Patient contacts, to add one of those, if you do have that information, you can hit add patient contact. You do, again, need the orange asterisk filled out to move forward, so you'd select the relationship type, first and last name. Oops. You could enter the date of birth. You can enter the sequence number if you have that information, or if they even want you to post that information in here. And then you can hit continue, and it'll bring up the same address entry screen that you use for the patient information. So if they have a home address or address you want to add in here, you can go ahead and add it. Even though it has orange asterisks here, you don't necessarily need it. You can just add the phone number. And then you can just add that, mark it as preferred, and hit save. So you don't have to have an address. You can just put in a phone number for your contacts. On your patient, you do have to have an address. And then you would come down here to the bottom and hit continue. And it's going to bring you into the initial order. So some agencies do this a little bit different. It's up to you guys how you want to do it. This information does need to be completed one way or the other to move forward. And even though this physician orders doesn't have an asterisk, you do have to enter information in there. So if you have the information, the orders, you can write in here, skilled nurse to assist in home health, or PT to assess an eval, whatever you guys want to do. This order can be sent to the physician to get signed if you guys require that. If it does, a clinician would actually need to come into this order and actually sign it. So I know you guys may or may not do that portion of it. If you are licensed to write orders, you can go ahead and apply your signature and a verbal order date. This is very helpful in one way for sure. With the PDGM billing, with Medicare now after January 1st, when we have to get those wraps out the door within 5 days, the system's going to look for two things. It's going to look for a signature and a verbal order date, and it'll look for that on this referral or the 485 after the patient's activated. Either one of those will satisfy the signature and verbal order date. The other thing it's going to look for is the first billable visit, and then it'll drop that wrap, and you have to get it out in that 5-day window. So if it is signed here, that'll help. Otherwise, the clinicians do need to sign those orders pretty quickly, and I have been telling them that as well. The other thing about the physician orders, you may have a faxed referral that you guys are going to upload to the system. If you guys aren't sending these referrals orders out to get signed by a physician, then you can say something like see uploaded referral orders, and then they would be able to go to the Documents tab and view that, and I will show you that here in a minute. Again, you can search for your physician or physician. I'm going to just choose this one here, and you can choose the physician type if you know that information. This can be added or edited later if needed. And then again, if you don't have the physician in here, you can add it if you guys have permissions to do that, but be very careful with that. So once you choose your physician, you get save. You can, again, that physician type, you can answer again now if you wanted to. The verbal started care, requested started care pulls over from when you were initially creating the referral. I'm going to just write that in there. And again, if you are a clinician and you are able to sign these orders, you can go ahead and sign this referral order now. If not, you can skip this part. It is not required. You can document their surgical procedures, nutritional requirements, DMEs, referring diagnosis, and additional diagnoses, and their meds. But be aware that information does not flow anywhere other than this order. So it's not required, and it doesn't go anywhere. So if you aren't going to send this order to the doctor, then you can leave this stuff blank. And then once you fill that out, below that, again, you have the opportunity to select the disciplines you want to go out if you know them already. So correct that if needed. The skills required, if you guys are going to use this is helpful in a couple ways. For one, you can use it just to identify that this patient is a wound care patient or a psych patient or both. This works in two ways. This will flow to the clinical tab so they can identify that it is this type of patient. But the other thing it'll do is if you have an associate that has this skill added to them on their profile, when you go to assign visits, it moves them to the top of the list saying that they're the best match for this patient. It doesn't, again, it's not required or anything. It just kind of helps you guys or the schedulers out if you guys use this function. So you could use that, and that's how it works. Then you'll just come down here and continue, and it's going to bring you into the patient encounter. It's going to show you are in a pending status. At this time, you guys can, edit any information on the profile tab if any of this was entered incorrectly or if you didn't have that information in the beginning, but now you have it. You could come in here and hit the edit next to personal and, correct their name, correct the date of birth or any other information in here. And you could add socials and email addresses as well if needed. Otherwise, if it looks good, you can leave it alone. If you guys have pictures of patients, you do have the ability to upload it. It would need to be scanned into your computer first so that you can upload that picture into this chart. To do that, you would just hit Upload Picture, hit Choose File. It'll open up a Windows Navigator window so that you can find the file on your computer. You would just click on it, hit Open, and you'll see that name of the file right here where it says No File Chosen, and you'd hit Upload and Close, and you would be visibly see that picture of your patient here. You may or may not use that feature, but it's available. Characteristics. Right now we just have some armed forces in there. You could add to the settings, or the administrators could add to the settings different characteristics like Spanish speaking only, or other language preferences. Anything that you guys want to add as a characteristic to identify your patient, you could do that. And then just pick what characteristic you want to add and hit Save. And you'll be able to identify that information right here. On this right side, before you activate the patient, this menu option is going to look a little bit different. You do have the option to change the agency if it was entered incorrectly, and the agency type, and the verbal start of care date, and the referral source, all this information. However, once you activate this patient, you will never be able to change the agency type or the agency. You would actually have to discharge it from the incorrect agency and readmit them into the correct agency. So make sure this is correct, and this is the only time you have to correct it when they're in a pending status. You can go ahead and assign these teams as well if you wanted to, and then just hit Save to update that information. So that's about the only thing you can do before they're activated. After they're activated, this patient, this pop-up will be a little bit different. It'll show the patient verbal start of care, and other VBP questions. I'm sorry, I'm talking too fast. And also their admission source, admission type, and that's when you'll be able to correct this as well when they're activated. Contacts, again, it's going to pull that information from what we entered in the referral, but now you can enter additional information. And again, you can update and change this information anytime you need to, even after the patient's been activated. And again, the referral order here, I'm going to skip the Notes tab for now. The referral order, this is exactly what you entered earlier. You do have the option to update this or edit this information if you didn't have it all completed in the beginning. You can come in here and edit this information as well. If you guys do send these referrals, you have the option to print this referral order. It'll pop up a PDF and allow you to print this off or download it to your computer, upload it to a physician portal, whatever you guys need to do. You can also fax this referral order directly from here. And then when you get that order signed and returned, there's an option to upload that signed referral order as well. It does need to be scanned into your computer if it's not already on there. And then you'll have this referral order tracking for those functions that'll tell you when you sent it and when you received it and who made those changes and if you need it or not. If you do need it and you edit this to say it is needed, then you'll get work basket items showing you that that's outstanding. And then again, you can edit the rest of this referral information, and you can enter face-to-face referral information here. However, if you don't have the documentation or it's not sufficient with what you have from like maybe the doctor visit note or whatever they faxed over on the referral and you still need this to be sent out, do not put a visit date in here. If you do put a visit date, this is the date of the face-to-face visit, then it's going to assume you already have that documentation and it's going to automatically fill in this date on the Orders tab and it will block the face-to-face from being sent with that first 485. So if you still need the face-to-face to go out, then go ahead and leave this blank, but you could fill out the rest of this information if needed. And we do have agency rules that will carry this verbiage over to the face-to-face, but again, leave that date blank so that it does go out to the physician. And that's it with that referral tab. Now the physician tab, if intake has the information, of course it does ask for the physician on the intake on the referral. If you need to add additional physicians and you already know that information, you can go ahead and add them as well by choosing Add Physician. And again, you can search the first or last name or just hit search and find that physician, put a checkbox next to their name and hit Save. That'll put the physician down here on this encounter, or down below the primary physician. However, if you needed to move these around, you could hit this top icon, and it'll move this physician up to the primary space. This needs to be, correct before we lock and send these OASIS and 485s, because this is the MPI that's going to get transmitted with the OASIS, and it needs to match the 485. So this is a pretty important piece to make sure you guys have the correct doctor in the primary position. The last facility data prior to start of care, you guys can add this as well. So if they were discharged from a facility, this will give the clinicians and all the office staff, everybody involved, that'll let them know where they came from. So if they needed to contact that facility to get further orders or med lists or anything else, you would be able to identify that here. To do that, you just choose Add Facility, and it will, you can choose the facility from the drop-down box. You can choose the when they were admitted to the facility, when they were discharged from that facility, and hit Save, and it will display that information right here. It's just for coordination of care to help you guys out. The Documents tab is the one that you guys may use quite a bit. So if you do get signed referral orders, or not signed referral orders, if you get referrals over on a fax machine, or if it came via email and you guys wanted to upload it to the patient record so that the clinicians can view it, etc., what you would do is come in here to the Documents tab. Under the Documents section down here, you're going to choose Upload Document. It's going to bring you up that upload file window that you'll see elsewhere where you upload things. You're going to choose File. Again, it brings open your little navigator window, and then you can choose that file, hit Open. You'll see the name of the file is located right here. Typically, you're going to want to keep these attached to Encounter. This is going to default to Encounter, because every time you discharge and readmit, you're going to start over with all new documents, all new consents and agreements, a new referral. Everything's going to be new. So typically, you want to leave this default to Encounter. You do have the option to attach something to the patient, which means even if you discharged and readmitted the patient, those documents would be available on the new Encounter. There may be rare circumstances, but like I said, most of the time you're going to need all new documentation for any new admissions. For the document type, you can choose whatever is appropriate here. And that list is customizable in the settings, so we can add new labels if needed. And for the document status, you do have to choose this. Basically, it's going to always be no action needed. A lot of these other ones are going to be automated labels that will show up if something is faxed and filled and stuff like that. So choose no action needed. You can enter a description for that document or in any additional note that you want. And then if you have more than just that one document, if you wanted to separate things, like maybe you got some lab results from somewhere else as well, you could hit Upload and Close and then look for that other document that you want to upload and get that uploaded as a separate file. But on your last document that you're wanting to upload, once you get this attached and you enter these two questions here below it, on the last one, hit Upload and Close, so that it doesn't open this window up again. And then, of course, you have minimum information required that you may not have, which could cause some issues. So hit Upload and Close on your last one, and then you'll be able to see that that document is here. And then, of course, if the clinicians want to see this, or anybody wants to see this, all they do have to do is click on either the document description to view this one document. It may download it, or it may open it. It depends on the file type in your browser settings. If it's a PDF, a lot of browsers will allow it to, open up automatically, etc. Otherwise, it will just download it. And the other option you have here, if you needed to download multiple items, if you had multiple items in there, you could hit a checkbox next to every item you want to download or print, and then hit this download print selected documents, and it would download everything into a zip file, and you can open it up with your system apps. When you come to this Documents tab, just FYI, since we're here, it's going to default to just the encounter documents, which again is what you're usually just concerned with. But if you did attach something to patient, you could filter it to patient and then be able to view that file. But 99% of the time, you're just going to leave it on the encounter. Intake may do this. They may identify a clinical team. You can choose to edit and identify who the case manager is, who the clinical manager is, so that is visible to anybody that has access to this chart. It's just, again, coordination of care. If somebody out in the field is curious about, needs to contact somebody in the office that's managing this patient, this is how they would identify who it is and what their phone number is. And you can, but you guys could even do this if needed, but you can add entire clinical teams. You guys won't do anything else over here. You guys probably won't be entering meds. You won't do anything with orders. The payers, if you guys are doing the payer information, you'll click on the payer tab, and then you'll see the link to add payer. And I'll show you a couple different ones. I'm just going to use NGS here at first. Now this category, if you come to this add the payer window, it's going to default that category from what you entered on your referral. So if you chose Medicare as their category, it's only going to display your Medicare payers. So if you needed a different one, you can filter it to the different payer category that you're looking for. Hit the green plus next to that payer, and then it's going to bring up the Add Patient Payer window. You have a sequence. Of course, the first one's going to be the primary payer. Typically, if you guys ever have more than one payer, you're probably going to have to run two different charts for those two different payers, but it really depends on the situation. You'll enter the start date of the payer, or it at least has to be a date equal to or prior to the first billable visit. So if we're admitting them today, 4/8, you have to at least enter 4/8 or a past date. If you entered 4/9, when they try to verify that visit for 4/8, it won't let them do it. So this has to be at least equal to that start of care date, or you can actually backdate it to the original payer start date. If there is an end date, if you already know that, you could enter that. Usually you don't. For the Build To address, click on that, and typically there's only one address per payer, so you just click that, but sometimes payers have more than one address, and you would see both of those addresses in here. You could enter the contact for that payer if anybody was added as a contact for that payer, or you can add the contact via this way if needed. It's not required. This is where you're going to enter their MBI number or HIC number, which doesn't exist anymore, but you'll enter their MBI number. If this is a Medicare a secondary payer, you need that code for black lung, end-stage renal, workman's comp, etc. This is where you would choose that. And then if it was an accidentally related cause, you can enter that information here. Then you would hit save, and it brings you into or it adds it to your payer tab. If everything is green, that means you're good to go on all that information. If anything is red, then it is going to show you, oh, I chose hospice. I should have put hospice in there. Let me just switch this around real quick. Okay, so let's work with this top one. So if anything's red, you'll need to address that. The eligibility for Medicare, for straight Medicare, is going to be run automatically. If it's any other payer, you're going to have to come in here and manually add their eligibility. So you're going to have to verify their eligibility through that payer, whether it's a website or via the phone, whatever, and then you can manually add it by choosing Add Eligibility. And then you would just say, yes, they are eligible, and what day that you checked it, and you can put in the start dates. Now, for Medicare, when that report is run, and then you add the eligibility, it is automatically going to pull the Part A start date, Part B start date, and end dates if those happen. And you'll just mark that they're eligible after you've read the report, and then you enter the date that you checked that. That's how you manually add it. Now, the Medicare will, like I said, automatically do it, so you will get missing work basket items saying that eligibility or payer requirements are not satisfied. And then you would be able to come to this payer tab, and you'll see when the result is run, under the description, if it is found, it'll say done found. And then over here under the result, you can click on that. There'll be an orange verbiage. You can click on that, and it'll open up their eligibility report and give you all that information. If it's not found, you'll get those descriptions here as well. Maybe it's because the MBI number was incorrect, maybe the patient's name was spelled wrong, things like that, and it'll tell you. Sometimes it'll give you a result saying that partial information matches, but it doesn't match completely. So you have to find out what's wrong, correct that information, and re-verify. There's this re-verify link right here. For Medicare, it's ran automatically every month, so you guys can. You'll get those work basket items saying that it's needs to be you need to mark them as eligible, and then you'll come in here and do the exact same process. Just while I'm talking about payers, for those payers that do require authorization, and I'm just going to guess on this one. Okay, so this one requires auth. So for the authorizations, you're going to see this little auth column, and you'll end up seeing a bubble here. If the payer doesn't require it, it's going to say NA. If the payer does require it, you'll see the little bubble here. If it's red, it's missing information. If it's green, that means everything's good to go, and you don't have to address it. To address the auth, you can click on that little icon, and it brings you into the authorization page or tab for that payer. And then you're going to choose Add Authorization, choose your category, enter the authorization number, the start and end date for that auth, authorized visits or units and hours, and then who authorized this. All of this information is required. You can see those orange asterisks next to every field. If you have more authorization for the other disciplines, you can hit Save and Add. But if this is all the auth that you need and have, then you'll just hit Save and Close when you're done. Okay. A quick way to get back out of this payer screen is to come up here and just behind this payer where it says Encounter, just click on that, and it takes you right back out of that. Now, any of this other red stuff would need to be filled out. Of course, eligibility, I showed you how to do that. NOEs is for hospice. Profile, it'll tell you what's missing. If you click on those and you go to that profile tab, if you see below here the missing information, this is what's missing. And if you click on those, it'll take you directly to where you need to enter that information. This one was a bill to address. This payer, HHS, does not have a bill to address. And so that's how you would enter your payers and how you'd enter your auth to get started. The next thing you need to do, or you can do this before you even get to that information, is you need to schedule that initial service. So up here by the top, by the patient's name, you're going to click on Schedule Initial Services, And again, from your referral, this is what disciplines are going to pull over. And it's only going to be the disciplines that are eligible to do starts of care. So even if you checked home health aid on the referral, they're not going to be an option here. So you're going to pick, put a checkbox next to those disciplines, and when they're going to go out, we'll say today is going to be nursing, tomorrow's going to be PT, or whatever dates it needs to be, and then hit save. You do want to try to get it on the correct date. And then this requested start this date automatically will pull from your requested start of care date, but you can edit that and hit save. Once that's on the calendar, I don't know if you guys are going to do any of this part or scheduling, but the visits are here, but they need to be assigned to whoever's going to perform those visits. So I will show you just real quick. You can click on that one visit, choose to edit. At this point, you can change the service code if needed, and then you can come over here and find your clinician. If they're grayed out, you can hit override availability check, and then hit save. And that'll get that one assigned to that clinician. Okay, and you can do the same thing for therapy, get that assigned to them. You can change the service code if needed, and then choose the correct therapist. Now they're here. And then these will show up on the clinician's schedules on their home screen, and they'll be able to start, they'll be able to enter the service note, activate the patient, and then they're going to enter the meds and do their 485 care needs and all the rest of that stuff. So that's essentially it for what you guys probably do. Do you guys have any questions?
I have a question, Brendan. We also process the resumption of cares. So if a patient went in the hospital and they're discharging and we need to resume care, how do we do that in intake?
That is an entire process. That's okay. So you would need to go to the patient encounter. To do that, you go to the patient's menu up at the top, go to patient encounters, and then you would search for your patient just like I did. So your filters may need to be changed. Christy's been in here doing her training, so some of these filters are different. You search for your patient, click on the patient name, and it'll take you into the encounter. The first step would be you need to place the patient on hold. So you click on up here by the patient name, place patient on hold. You're going to select whether it's patient request or admitted to facility. If they are admitted to the facility, you would choose the facility name here. And then you want to put their on hold date. Now, and I've told the clinicians as well, even if you know, and I've already been using this guy for testing purposes, so even if you know the off hold date, you do not want to enter it right now unless it was per patient request. If it was per patient request, you can go ahead and do that. That's fine because you don't have to do a transfer OASIS. But the only way we can get a transfer OASIS put into the system is if the patient is currently on hold. So if you were to put an on hold and off hold date, it just creates a hold record and the patient's never on hold. So you want to leave this blank and hit save. Now I did a future date. That really wasn't a good idea. Let me see if I can do today's date. Okay. All right. So when the patient's on hold, you'll see under the current encounter, it'll show the status, and up here at the top in the banner, it'll show you the status that they're on hold. The next thing, and I don't know if you guys are going to do it or not, but you would obviously write an order to the doctor and let them know the patient's on hold due to admission to such and such facility, and you'll resume care whenever they're discharged, whatever you guys are used to writing. To do that, we don't have an order that's called hold order or anything like that. So you'd come in here and typically use the add other interim order. To get to that menu, you hover over the action item menu next to the 485 during the episode that you're placing the patient on hold. So it's this one, and I'm going to come over here and do add other interim order. Choose the effective date. We'll say today, hit save. And then we'll write, patient on hold due to admission. And then you'll send this to the physician. It does need to get signed by a clinician. If you guys are able to do that, all you have to do is hit enter signature and choose accept. If not, then you can just save and close this order, and then another clinician will end up having to sign that. Of course, so you got your hold order, you've told the doctor. The next thing you need to do is add your transfer OASIS. To do that, you hover over the action item menu next to your 485 in the episode you're concerned with. And you're going to choose this add OASIS. This is a standalone OASIS that no service note is attached to, which is usually the case when it comes to transfers. Otherwise, usually you're not there in the house knowing you're going to transfer them before you start to visit. So 99.9% chance it's going to be a standalone. So you're going to choose add OASIS. You're going to choose your transfer, not discharge from agency OASIS, and then you're going to hit save. It will bring you into the OASIS to be filled out. Again, if you guys fill this out, you are able to fill this out, you guys can. If not, just save and close, and then the other clinician that needs to fill it out would be able to come into this edit pencil and fill that information out. But this has to be in place before the clinician ever tries to add a resumption of care. With CareFishing, we have logical time point sequence. So you got to have a start of care before you have anything. You have to have a transfer before you have to have a rock, and so on and so forth. So it's not going to let you add things out of sequence. This just has to be in place no matter what. So then you find out your patient is out of the hospital. What you're going to do now is you're going to come in here to the patient encounter, and you're going to reactivate the patient. And you're going to enter your off-hold dates, and then you have the option to either remove scheduled services or do not remove scheduled services. If they go to the hospital, 99% of the time, you're going to want to reevaluate that patient, reassess them, and determine their frequencies and duration. So you're going to start over at that rock with your scheduling. So that's usually what you're going to do for home health. Now, again, if it was per patient request, they were on hold not due to hospitalization, you do not need to enter transfer OASIS. And when you reactivate the patient, you do not need to remove scheduled services. You're just going to pick up where you left off. So that's if it was a patient request, but you still need to notify the doctor why you're not seeing them in between those, the last visit and this next visit. So you typically choose remove scheduled services, hit save, choose OK. And then we need to add a resumption of care order. So I'm going to get rid of this other interim order real fast. To add a resumption of care order, some of these other order types do need to be in an approved status, especially if they deal with frequencies and durations, because they have to be approved sequentially in order so that we don't have any issues with your frequencies and durations, and the system forces you to do that. So that's why you have to approve those orders prior to then. I don't know why this one's approved. Apparently I already put in a resumption, so this is a 537. Hold on just a second, let me straighten things out. Okay, so let me clear this up real quick. Mm. Okay. Oh, goodness. Okay, so to add a resumption of care order, you're going to hover over the action item menu next to your 485, and you're going to choose Add Interim Order. And then you're going to get this pop-up window. For the interim order type, you're going to choose Resumption of Care. And then you're going to pick the discipline, the primary discipline that's going to do the OASIS resumption from this list. And then you're going to choose the day of the resumption visit. And then you're going to hit Save. That's going to bring you into this order, but at this point, you basically just save and close. It is going to plot this assessment visit on the 8th for the skilled nurse. So I just hit Save and Close. If you guys wanted to add additional information to that order, you can, but we want to leave it open so that after the clinician goes and reassesses that patient, then they would be able to come in here to this order and add to the rest of their frequencies and durations. Now, if another discipline needs to go and assess this patient, 485s and resumption of cares are the only ones you can do this to. But if you hover over the action item menu next to it, you have the option to add an assessment service. That's like the schedule initial assessment. Those are the only services that you can assign to a clinician. They can go out there and assess the patient, write a service note. They can have scheduling notes attached that can be verified, and it does not lock down your frequencies and durations inside of the order. If you plot any visit inside any order, for instance, a 1-week one, maybe you wanted to try to do it like an assessment like that, the second you assign it, it's going to lock that frequency and duration down inside that order, and then either have to back that up or they're going to have to write an additional order to do the rest of their frequencies and durations. So you always want to add assessment services either by the schedule initial assessment up at the top when you're first doing the referral, or after they've activated, you can hover over the action item menu next to the 485. This one's approved, so I can't do it. Or a ROC order, and you're going to choose Add Assessment Service. This will bring up all the other disciplines that are available. You can see skilled nurses already plotted, so it won't let me do it. So you can pick those other disciplines that need to go out there and reassess the patient for the resumption as well. Choose the correct date that they're going to go, and then hit Save. And then all that needs to be done at this point is under the scheduling. These need to be assigned to the correct staff. Let me get rid of those canceled visits. So now I have my 3 assessment visits here that just need to be assigned to the clinicians, and then they'll show up on their home screen, and then they'll be able to go out there and perform their OASIS integrated assessments or reevals. A good thing to do with ROCs and any other visits that you guys want to, you can click on them and add notes. These aren't service notes. These are just like little scheduling notes. If you want, you can click on that and just put them a general note in there and tell them, hey, this is a resumption of care, and any other just information you want to add and let them know about. Maybe the patient's not going to be discharged till noon, and information that any valuable information, this is going to give them a heads up. So on their home calendar, they're going to see these visits on them for this day, and then they're going to click on these notes and see what they say. So that's something else you guys may want to do even on admissions, ROCs, anything that you guys are involved with that might be helpful. that's something that you guys can do because it's going to really give them a heads up out in the field. Even though they're supposed to go in there and read all their orders, everything else, it does give them a heads up prior to even going to the house or prior to even scheduling the visit of any pertinent information you guys want to give them. That's the ROC process. Do you guys do anything with discharges?
I just have a question real quick, and I work with Sonia. So Sonia, help me out with this. When we get discharged, when we get discharges from hospitals, and at the very last minute, they add another discipline in. So we have to make sure that, I'm just asking to confirm, we have to make sure that all those disciplines are on the initial order before scheduling assigns it. Because once scheduling assigns it, we can no longer modify it, and we have to create a whole new order, something like that. Am I on?
No. You have an option. When you hit that schedule initial service link up at the top, it will go away forever unless you go to the schedule and you delete those assessment visits. So that's the only time you could correct it. You could delete those assessment visits. You can go back to your referral order, edit the referral information, choose those other disciplines, hit save, and then, you know, as long as you deleted those other services off, that schedule initial service link will come back, and you guys can click on it again, and then the other disciplines will be available. If that's not doable, if a nurse is already out there and seen the patient, for instance, and they have a service note, and you can't delete it, the thing is the patient would be activated if the other nurse saw them. So let me get this to an unapproved. So if you get that information after the fact, as long as this 485 is in an initiated or saved status, as long as it's not approved or sent to the physician or received, you can hover over the action item menu next to that 485, and then you have the option to add assessment service. So you can click on that and then pick those other disciplines that you needed to add, the correct date, and hit save. So that's the only two ways to, I mean, you kind of have to back things up if you have time to do that, or you just have to add it directly to the 485 from outside of the 485 like this. And then again, you can correct the referral order, especially if you're sending these to get signed. You can come back in here and make it match. You can hit edit and then choose the disciplines to make it match. Of course, if this has already been sent, there may be some issues, but you know, a lot of agencies are still doing their referral information on their 485s. They're not sending these out, but we have agencies that do referral orders and make sure they get signed. So we do have the function. We can do it either way.
I think we send ours out on the 485s.
I'm sorry?
We send ours out on the 485s in our agency.
Yeah. A lot of agencies will. They still do. And it doesn't really matter. You know, it's up to your agency and your state and auditors and what they're forcing you guys to do. But just remember, for the PDGM, it's going to look for a signature here or a signature on that 485. So, you know, I've been telling those clinicians, you know, either way, you guys get in there and sign it as quickly as possible. You can sign it way before you're even done with it. We just need to have that signature in place for the PDGM so we can get those wraps out.
All right. You were asking if we ever discharge. We do discharges. Let's say that, you know, a patient that comes on service, they say they want us. The nurse goes out there and they decided that they didn't want service. So then they notify us and we have to discharge that patient, or that patient never got seen. So would you consider that a discharge, or?
That's what I would call a non-admit.
Okay, so we do
you have this option to decline the referral in those scenarios. So if you only went out and did that one visit and you decide, oh, you know, they don't qualify, patient refuses, whatever, you do still have that option to decline the referral, and that's going to make their status a non-admit status. So you do have that scenario. And then I don't know if you guys are in charge of this too, but you have those scenarios where a patient goes into the hospital through the end of the episode. You do have that option to go ahead and, after this patient's activated, you can go ahead and discharge the patient, get a discharge order in there, and add the standalone discharge oasis. Help if I could spell. So let me show you on this one. And you've seen this now. These statuses or these options up here do change based off the status of the patient. So if they're on hold, it won't say place on hold. It'll say reactivate the patient. If they're not activated, it'll say activate instead of discharge. And then it'll also have that decline referral option that would be up there. So these change based off the status, so just be aware of that. But to discharge a patient, like if it ended up being the end of an episode, and they were still in the facility, and you guys are just going to go ahead and do an administrative discharge, which means all you have to do, no, that would be a scenario if you have a transfer already in place, then all you have to do is discharge the patient, do a discharge summary, and you're done. You don't have to go back and try to add a discharge oasis. If you didn't have a transfer in there for some reason and patients just flat out refusing service, whatever, then you do have the option to discharge patient. You'll select the reason, and it will require an order type, so you do need to choose which one of these discharge forms you want to use. Pick whichever the one's applicable, hit save. If there's any errors like that, I was trying to discharge them after the end of the episode. It'll give you those errors. You'll have to correct that. So once my patient's discharged, it did add a discharge form for me or discharge summary. This does need to be filled out by whoever's going to do it and signed and sent to the physician. But if you do need to do a standalone oasis, you would hover over that action item menu, choose the add oasis. Now it's not going to give me the correct option because I don't have a starter care in there. Let me just add that first. So as long as there's a starter care in there, when you do that discharge, you can hover over the action item and you choose Add Oasis. Right here on that menu. And then now you're going to have the transfer DC, DC, or death at home options. So the patient has to be in the status that they're going into to get the Oasis type you're going to be looking for. I mean, this needs to be done before a nurse starts their service note. So if they do the visit and it was a discharge visit, it was just the end of the episode, they're not going to reinsert. This patient would need to be put in a discharge status before the clinician has the ability to add a Oasis integrated assessment and to be able to choose, the discharge from agency. So again, CareFish is trying to keep everybody compliant. So patient has to be on hold to get a transfer, not DC. Has to be put in a discharge status to get the transfer, DC, death at home discharge. You're always going to have the option for another follow-up as long as you have your starter care in there. This can be done. This is like first kick, and it can be done any other time of the year, episode that you need to. So that's always always available. You would choose your discharge and hit save. Again, it brings you into the Oasis. I don't know if you guys would be filling this out or if you'll have the clinicians go and do it. But it would just need to be filled out at some point. Otherwise, you can save and close it just to get it done, get it out of the way, but somebody's going to have to get that finished, filled out. And the work basket will show everybody that there is open Oasis that need to be locked. So there's going to be workflows showing you guys that these need to be taken care of.
Yes.
Any other questions?
I have a question. If we have a patient that had been admitted for us and then they were discharged and now they're readmitted at a later date, does the information like the positions just populate over, or do we have to re-enter?
No, it will flow. you'll actually get a pop-up window, and it'll ask you what you want to flow over. Do you want to carry over the meds, physicians, contact information, etc.? It'll give you a pop-up window when you readmit them, and it will allow you to just migrate all that information back into here. Now, it will always, even if you don't migrate that information, it will always keep the same medical record and the basic demographics. So that stuff will stay the same.
Okay.
But you may, and you may not want the physicians. Maybe they have fired their old one, and then you just want the new one in there. So it would just depend on those different scenarios if you truly wanted to do that or not. And that was really, I could show you real quick. Let me just throw something in here really fast. So that was this part where you're going to search for the patient. So then once you search for the patient, again, it's going to give you a list of every patient with the matching information, and it's going to highlight that. So then all you would have to do is click on the checkbox next to that patient. Then just below this grid, you're going to hit this continue button right here to the right. And then this is the readmit stuff. This is the stuff you can copy forward. All the meds, only the active meds, advanced directives, disaster plans, vendors and vitals. These are the vital parameters. So you can check all that you want over there and then just hit continue, and then it will migrate that information to the new encounter. Some stuff's going to have to be re-added, but these are the ones that are most popular, the meds, the advanced directives, and disaster plans. But you can do all the rest too, vital sign parameters and vendors. And then it just comes in there. It will pull over their address already that exists, but you could edit that if they've moved. Again, you can address the contact information, but then it's going to bring you right back to that referral that you need to enter. And then, again, into your encounter.
I actually had kind of a suicide.
And it did pull over that physician as well.
One more question.
This might be kind of a specific question, but in adding additional physicians, I noticed that when playing around, we have our hospice doctor, who's also our medical director, which I think would be considered a certifying doctor and proficient. Is it possible to add the same physician as two separate kind of roles, both the attending and the certifying, or can you only add the same doctor once?
You can only add the same doctor once, and I'd probably have to get with Christy to see how they do that part. I think they just identify, you put the physician here, but then on the cert recert is where they're going to, I think that's where you're going to identify whether it's the certifier or not. But I'd really probably have to double check with Christy on that part. For hospice.
Thank you.
No problem. Yeah, you would not, on the physician tab, you would not be able to add that same physician twice. If I was to look for this physician, you'll see that it's grayed out. You won't be able to use them again. See how there's not a checkbox next to them? So you cannot add them in the system twice. So that's going to be a different process that we can ask Christy about.
So the certifying is basically the one that's signing the 485? Yeah.
Those labels are only labels. They don't physically do anything. That's for your information only. Basically, it's just for you guys to identify those types. It doesn't change anything with billing or with the orders or anything. It's only for identification purposes for you guys. So whatever you guys feel comfortable using for that is that's fine. You got attending, certified, not for billing, primary, and referring. And they could be they could be the referring and the primary. They could be the primary and attending, whatever. but you'd only be able to label them one thing, and you can only add them to the encounter one time. And you're only going to see it right here. The only thing that really matters on the physicians is the primary physician. Again, that's whose MPI is going to go out on the OASIS, and of course it needs to match the 485. And then this is the doctor that all of your orders are going to default to, but then you'll have the ability to change the physician. You'll have a drop-down box, and every physician that's added to this tab would be available inside the order, so you can pick and choose which doctor you receive this from, so you can send it to the correct physician. But again, only one doctor at a time in each physician tab.
Okay, thank you.
No problem. Anything else? And one thing I didn't mention, if there is missing information, you won't be able to activate the patient, but you guys won't do it anyway. But this does need to be corrected before the clinician out in the field can even activate the patient. So on the profile tab, it'll tell you what's missing. And in this case, when it says missing physician orders, I didn't put anything in that physician order right here. I didn't put any verbiage in there, so that's what's preventing me from entering or activating the patient. So even if you do upload those referrals, you have to put that verbiage in there that just says, see uploaded referral or whatever you guys want to do. The other thing is, if you don't see the scheduling link up here, right now you're going to see the schedule initial service because we put this in as a new patient. But if you don't see the scheduling link after you've scheduled and assigned those initial services, it's because the payer is missing. It won't let you schedule unless there's a payer in there other than the initial services. And the reason is because all of those services are going to be based off those payer requirements and rules on whether or not auth is required or if they even cover that specific discipline, things like that. So scheduling is limited until you get that payer. All you can do is schedule the first visit, first initial visits. But I think that's pretty much it. Do you guys, anything else?
Is it a 12:30 or 1? Yep, 12:30 just
I think we're good.
Awesome. Well, if you guys have any questions, we're always here for you anytime, So just reach out to us and let us know if you have any questions, and we can. If it's something simple, of course, we'll respond in an email or give you some links to instructions. But if it's complicated, sometimes we have to set up another meeting. So we'll just kind of, go from here and see what happens. But if you have any questions, please let me know.
Thank you for setting this second meeting for intake up.
Yes,
No problem. You're welcome. You're welcome. You guys have a great day, and we'll talk to you again soon, okay?
Okay, thank you.
Thank you.
Bye-bye.
You're welcome. Bye.